Legends and Losers is sponsored by Oracle NetSuite. Learn how to turbocharge your business's growth today at netsuite.com/legend. We have an extraordinarily special episode today. Our guest is Darold Treffert. He's the world's leading expert on savants, genius, and autism. And we hacked the mind of Darold to hack the minds of leading geniuses in the world. And we talk about Rain Man, savants and genius, the difference between the brain and the mind, what all this means for human potential, and why mellowing is important, and why Dr. Treffert is so optimistic. All right. Hey ho, let's go. Hello, my legendary friends. This is an extraordinary episode of Legends and Losers. I'm incredibly glad you're here, and I would encourage you to strap yourself in for what is one of the most extraordinary conversations with one of the most extraordinary people I've ever met, Dr. Darold Treffert. So let me share with you what Oliver Sacks has to say about Darold Treffert. And Oliver is the professor of neurology and psychiatry at Columbia University Medical Center. So here's what Oliver says about Dr. Treffert. Quote, "No one in the world can match Darold Treffert's experience and understanding of savant syndromes. He has spent nearly half a century immersed in the subject. And when he writes of the beautiful mind of the savant, Treffert shows the openness and generosity of his own mind. Islands of Genius brings us fully up to date with the latest research, and like all of Treffert's work, it is imbued with deep intellectual and emotional understanding. This is a remarkable examination of the human condition." Oliver Sacks, professor of neurology and psychiatry at Columbia University Medical Center, talking about Dr. Darold Treffert's work. So, we talk a lot about wanting to hack the minds of some of the most legendary people. Well, that's what Dr. Darold Treffert has been up to. He's a Wisconsin psychiatrist who's been studying savant syndrome for over 50 years. He's the author of this extraordinary book called Islands of Genius, The Bountiful Mind of the Autistic, Acquired, and Sudden Savant. That book won gold medal in the psychology and mental health category at the 2011 Independent Publisher Book Awards. His earlier book, Extraordinary People, Understanding Savant Syndrome, was also the first work to comprehensively summarize what is known about this fascinating condition. Dr. Treffert was also a consultant to the movie Rain Man, and Rain Man, in case you don't know, is the incredible movie where Dustin Hoffman plays an autistic savant with Tom Cruise. And it's Dr. Treffert talks about being involved in Rain Man during our dialogue. In addition to his work in the area of savant syndrome, Dr. Treffert has also lectured nationally on a number of topics for a number of years, including his idea of mellowing. His booklet, Mellowing, Lessons from Listening, is widely distributed and very much worth reading. You can find him on the internet at treffertcenter.com. That's TREFFERT Center, CENTER.com. Dr. Treffert's been on the Huffington Post, ABC's 2020, NPR, the BBC, CBS Sunday Morning, CNN, Dateline NBC, and 60 Minutes. And here he is on Legends and Losers. So, Doctor, what is a savant?
Well, savant syndrome is a rare but remarkable condition in which somebody with an underlying disability, often autism, but not always, has some island of genius that stands in stark contrast to overall handicap. And the juxtaposition of impairment with superior ability is a jarring one, but one which captures immediate attention.
So one of the many, many fascinating things I want to speak with you about today and hear from you on, but there seems to be a connection, or tell me how you think about it, between extraordinary ability and some extraordinary disability.
Well, actually, it's the disconnect, which is so jarring when you see it, that somebody with so many disabilities or impairments can have this area of superior ability. And that's what caught my attention to begin with. What happened is I was finishing my residency in psychiatry in Madison, Wisconsin, and had my first job was to start a children's unit at Winnebago Mental Health Institute in Wisconsin. There were 800 patients in the hospital, and the 30 of those were under 18, and so we gathered them together in a unit. And most of them were autistic or had some other severe impairment. And 3 of those caught my eye. One little guy had memorized the bus system of the city of Milwaukee. And if you told him the time of day and the bus number, he would tell you what corner that bus is going by. A second little guy was mute, but if you put a 250-piece jigsaw puzzle in front of him, picture side down, he would put it together just from the geometric shapes that he saw. And a third little guy was an expert on what happened in this day in history. And every morning I'd come on the unit and he'd say, Dr. Trevor, do you know what happened in this day in history? I tried to bone up the night before. And that was in the days of the encyclopedia, by the way. There was no Google, but I could never outsmart him. And so I got interested in these cases where there was this jarring juxtaposition of ability and disability, and said, well, what does that say about the ability within us all? What might that say about our own potential of people with this much inability can have this kind of ability? What does that mean about the ability within us all?
And what, I mean, you've been studying this for, correct me if I'm wrong, but over 50 years, have you not, Doctor?
Yes, correct, right.
And so what have you learned about that question? I mean, it sounds like that's an amazing question.
Well, I think what I've learned is that there is this there is this ability, dormant ability within us all, and the trick is how to tap that without having some kind of brain injury or disease. And it's what happened originally when I started working with these children is that I said, no matter how imprisoned that child is by their autism, and no matter how buried deeply within them is some ability, is what I call an island of intactness. And our job in trying to deal with a child with autism is to find that island of intactness, celebrate it, love it, congratulate it, nurture it, and let it come to its full bloom and potential. And that's what I've seen happen in savants that I followed for many years. And this became more apparent to me with the so-called acquired savant. Most of the savants that I had met early in my career were children whose autism was there and their ability showed up as a child and went on to adulthood. But then about 20 years ago, or I guess 15 years ago, I began to encounter cases of individuals, ordinary people, who had a head injury or a stroke or a dementia. And as that process left them with some impairment, there was an instant musical ability, art ability, or mechanical ability. And it just surfaced unexpectedly. There's a case of Derek Amato who dove into a swimming pool, had a concussion, recovered, and was drawn to the piano, which he had never played before, and sat down and played the piano for 3 or 4 hours, and which he had never done before. Orlando Sorrell is a 10-year-old boy, got hit in the head by a baseball. And after that, began to calculate, but also now remembers what happened on each day of his life, and can tell you what happened, what he had for supper on July 4th, 2012 or whatever, and other cases of the acquired savant. began to
So
emerge.
Dr. Treffert, I hate to interrupt you, but
Yeah.
should I ask my friend, the boxing coach, Nick Townsend, to punch me real hard in the head, and maybe I'll be able to play guitar like a virtuoso? Is that what you're suggesting?
Tell them to hit you in the left anterior temporal area, however, not just anywhere in the head, but the left anterior temporal area.
You draw like a little mark on my bald head where you want them to hit me.
Sure, right. You might be a musician, you might be a poet, you might be an artist or a visual spatial expert, who knows. But at any rate, as I saw these cases come forward, it raised the whole question about that dormant potential. Does that exist within us all? And I believe it does, to greater or lesser degree. We're not all little Mozarts or Picassos, but we do have abilities that are dormant. And this injury taps that. That raises so many questions. First of all, how does that dormant potential get there? And more importantly, and the search I'm on now, are there ways to tap that without having a head injury or without having some kind of a central nervous system incident? And I believe that there are.
So what are those ways?
Well, there are a number of ways. One is electronically. We know, for example, that Dr. Alan Snyder in Australia has invented what he calls the thinking cap, which uses rapid transmagnetic stimulation, or now direct current stimulation, of certain areas of the brain, particularly the left anterior temporal area. And in ordinary individuals, and so if you put that area to sleep for a while with that electrode, indeed some savant abilities do emerge in ordinary persons, not necessarily at a prodigious level, but nevertheless, and we know, for example, deep brain stimulation is used now to treat Parkinson's disease or depression. So I think.
So Dr. Treffert, I want to make sure I understand.
Yeah.
It's an electric. What I don't know. You tell me. In the old days, we might have called electric shock therapy. We're shocking parts of the brain with electricity.
No, what it is it's a skull cap that you put on with electrodes that are on the surface of the head, and it's like the same mechanism that's used to record an EEG, for example.
I see.
And instead of recording the EEG waves, you transmit some current into the brain, which temporarily immobilizes that area of the brain. We know that's used in neurology and other techniques. And if you do that, you can demonstrate now with problem solving and other kinds of tests that the person is smarter than they were before.
So I just want to make sure I underscore what you're telling me. There's a therapy that shoots some electricity into my brain that will make me smarter than I was before that electricity was in my brain.
That's correct. That's actually happening.
Can I buy one of these on Amazon, or where do you get them?
Well, as a matter of fact, you can. If you go to, I think it's Focus, Focus, or some such, you'll see kits that they're trying to sell people before their final exams to make them smarter. I think they probably don't have a legitimacy the way Dr. Snyder does, but nevertheless, people are buying them and they say that they help. So electronically, I think there are ways to do that.
And is this also, I've heard you talk about a brain pacemaker. Is this the same thing, or is that something different?
No, it is the brain pacemaker. And we, 20 or 30 or 40 years ago, if we talked about heart pacemakers, that was just a beginning. Now it's done every day. And we know, for example, that with certain patients with epilepsy, that you can develop electrical connections that will abort their seizures. And when the patient feels a seizure coming on of the aura, press a button and the seizure is terminated. This is being used in Parkinson's disease and, as I say, in deep. So the era of brain pacemakers, while it's sort of new now, 10 or 15 years from now, that'll be at the same level as heart pacemakers.
So I have a personal question. If you could maybe diagnose me here, that would be great. So I'm somebody who's dyslexic, and I have, best I could tell, many of those quote unquote learning differences. And then about 6 or so years ago, I was diagnosed with an unnamed, unknown neuromuscular condition. And what they've told me is I have and I've been studied at Stanford and at UCSF. And what they've told me is that there's a disconnect between the way my brain and neurology works together, and that I have a hyperactive neurology. And how it manifests itself is I experience very severe cramping. And the solution to it was actually an epilepsy drug, which I now take every day. And if I didn't, I wouldn't be able to do the athletic things that I love to do in my life. And so are you seeing in all of these sort of disorders or diseases where there's a disconnect between the brain and the neurology that controls the body, that there's a real breakthrough waiting to happen there, or maybe it's happening?
Yes, there is. And I with a number of conditions, as I said, Parkinson's disease now with deep brain stimulation, or refractory depression. And I think that number of maladies or disorders will increase in our use of electrical approaches to those. Now, for the Dr. Alan Snyder's work in terms of brain pacemaking, making us smarter, those are simply electrodes that are attached to the skull, but they're not intrusive. A deep brain stimulation obviously can be very intrusive, but we're learning so much just from that. For example, there was a researcher who was looking to see if he could treat overweight with finding the appetite center of the brain and somehow manipulating it to slow it down so the person doesn't eat as much. And that's actually in the hypothalamus. And in the search for that site, he was using electrodes, and as he would stimulate certain areas of the brain on the way down to find the hypothalamus, memories would just flood forth that the patient had never couldn't access in regular time. And this was work that was done by Luria years ago, as he was looking to find the epileptogenic site scar that was triggering seizures. And as he did the same thing, you'd put the electrode down and they say, "Oh my God, that's my 5th birthday. There's Aunt Mildred and Uncle Tom," and things that they had never memories. And so there's that for beginners. There just for beginning is that vast storage of memories.
There's old home movies trapped in our brains that we all get to enjoy again.
Indeed that. So there we're finding the problem is, of course, with deep brain stimulation, it can be very intrusive in terms of actually implanting an electrode in the brain, just as we do in the heart, is a very intrusive procedure. But nevertheless, on that journey, we're finding a great deal, and I think we'll find the not only the way of making us smarter, but I think we'll find ways of treating disorders with electrical interventions that we don't even know about at the present time.
And so, Dr. Treffert, do you envision a day where, whether it's recovery from a concussion, or whether it's a cure for Parkinson's or Alzheimer's or some other dementia-type condition, where we'll actually be able to cure that stuff?
I think there certainly with epilepsy and with other conditions, and Parkinson being an example of where there's a disconnect in the brain between activation and suppression of physical movements. I think that there will be And it's already being done in terms of brain pacemakers in those conditions. Hopefully we'll be able to devise techniques that are not necessarily that intrusive and maybe can be generated just from a skull cap.
And let me ask you a wild, self-serving question. Is there any connection you see between neuromuscular breakdowns and dyslexia, ADD, dyscalculia, and the kinds of things that I've been diagnosed with? Is there any connection between those things, or are they completely unconnected?
Well, I've been spending a good share of my time not only with savants, but with hyperlexia. That is, children who read early. At 18 months or 20 months are reading and comprehending. And we're finding, we're exploring that and finding that the neurological hookup is almost exactly the opposite in dyslexia between as opposed to hyperlexia, for example.
So I hate to interrupt you, doctor, but it's a flip of the same wiring. Is that how I might think about it?
Yes, indeed. Right. And also of the wiring and of which hemisphere is dominant and where is the language
hemisphere being
center.
right brain and left brain that we hear so much about. Yeah.
Right. And finding out that for example, there's a condition called the Einstein syndrome, in which children who speak late turn out to be really extremely bright. And we have a little guy that I'm working with now. He's 4 years old. He came to us and was not speaking, and after 6 months or so began to speak. And is he ever speaking now? He has the planets memorized, the whole solar system memorized. He has names of shapes that I've never heard of, is able to do calculations with numbers of digits, and recently has memorized the periodic table.
How old is this little guy?
He's 4 years old.
If you put a gun to my head, doctor, and said, memorize the periodic table or we'll kill you and your entire family, we're all going to heaven or hell or whatever you believe, but I ain't getting the periodic table right.
Exactly. And of course, as when I was in medical school, I had to learn the periodic table. But I can't keep up with his quizzing me about it now. So,
I would pay money to watch the two of you riffing on stuff like that.
No, it is simply, and the thing that is astounding. Before we raised questions as to where in the world is he learning about the solar system and so forth, and I don't know where that came from now. But now he's discovered Google. And so he is quizzing everybody about everything through Google. But
so now he's got this incredible brain, and he's got this incredible technology, and he's got everybody surrounded with knowledge. Is that what you're telling me?
That's right. And I think he and there's another Einstein patient who I think he's 18 years old. He's getting his PhD and in quantum physics theory, and is involved with several of the really famous quantum theory institutes. And they're convinced that he is going to take them farther than they've ever been. But it started with this late speaking. Einstein himself didn't speak until he was about 4 years old. That's why it's called the Einstein syndrome.
Now, I must ask you, I have a new friend in my life whose name is Bill Walton. And Bill is considered to be, by the NBA, one of the 50 greatest basketball players of all time. And he's an extraordinary player, and he's an extraordinary man. He's retired now, of course. And he's a broadcaster today. But interestingly enough, he suffered severe stuttering as a child, and he wasn't confident speaking. until he was a young man and in the NBA. And so I'm curious, is the same thing true for stutterers, or how should I think about that?
Well, I think we're trying to learn about stuttering, but yes, that the incidence, for example, of autism, stuttering, learning difficulties, other kinds of, especially learning difficult speech and language disorders, is about 5 times more common in males than females. And there is a link between autism and the speech and language and learning disorders. And I think we'll be able to unravel that. Our technology that we have now is rather amazing. It makes really, the MRI makes really pretty pictures. There's screen and there's, but frankly, it is still at a rather superficial level in terms of, it's great for finding out, is there a brain tumor or a space occupying lesion? But when it comes to the wiring of the brain, which is really what we're talking about here, we need to have more sophisticated equipment than we do. There are several techniques that will look at the wiring of the brain, but we need to get even more down to the synapse level, and we're getting there. And that, I think, will unravel some of the what is the connection between stuttering and late speaking children, or hyperlexia, or some of the other speech and language disorders. So we're getting there, and it's amazing what we're seeing. But often, if I'm on a program and talking about savants, they want to do an MRI and they want me to point to where that MRI shows the savant syndrome. Well, right. We're not there yet.
Right. So you can't show me the green blob on a savant's MRI and say that's the savant part right there.
No, right. But some of the newer, there's a technique called diffusion tensor imaging, which actually looks at the wiring of the brain, and so you can see it's like taking the top off your computer and looking at the wiring. You can actually see the wiring. You can see the connections. And through that kind of a technique, one of the problems has been, though, that especially with some autistic kids or other children, it's sometimes hard to get them to be still for as long as you have to be when you're doing these techniques. And there's now something called a PET helmet, which is a PET scan, which is another form of imaging, which can be very sensitive. The person can be wearing this helmet and exercising or walking or doing something else, and you're able to record. Because with savants, if you want to find out what's going on, you have to be able to demonstrate the brain at work rather than just static architecture.
So and there's no point in just watching a savant's brain in one of those big MRI units while they just lay there and think about nothing?
Correct. So now functional imaging will allow them to do certain tests and be able to see the brain at work. The problem with that has been being able to have them stay stationary enough to be able to do that. But now with the PET helmet, that's just another step along the way.
Interesting. And are all these new technologies, you talk a lot about what you have called the 3 R's, and I'd love you to unpack those. But are these technologies essentially making the 3 R's, I don't know what maybe the right way to think about it is, but more doable, more robust, or so help me with the 3 R's and how they connect to the technologies, Doctor.
Sure. What happens, again, with the acquired savant is that there is an injury, often to the left hemisphere, not always, but most often to the left hemisphere. And then there is an attempt to find undamaged cortex in the right hemisphere. And there is a connection then between the the undamaged and the damaged area, and that is a rewiring to that area. And then there is the release of the potential within that area, so that there is the search for recognition of undamaged tissue. There is rewiring, and then there is a release of the dormant potential within that area. And we're learning more about those the 3 R's, as I call it, which has led us to show and demonstrate that this dormant potential does exist within us all. And the trick now, as I said, is to be able to connect those areas without having a head injury or something. And that's happening. The first area we talked about was electronically. The second area is pharmacologically. We know, for example, that people who take amphetamines have a short-term memory, not impairment, but ability. It increases short-term memory capacity in the short run. The problem is that there are problems with amphetamines in the long run.
Oh, I thought you were telling me I should start Breaking Bad right now.
Yeah. Well, we know, for example, that the psychedelic drugs, LSD, have a tremendous ability to affect the rewiring and the brain function.
So what do you, I hate to interrupt you, Doctor, but
yeah.
I just had a conversation about this on Legends and Losers. What do you think about this quote unquote microdosing of LSD to deal with various conditions or brain neurological situations?
Well, I think that should be explored. I think that there needs to be some really basic science effort in using the psychedelic drugs, marijuana, or other chemicals to see not only to treat certain conditions, but also to increase brain capacity. On the internet now, there are all sorts of brain boosters out there. You can, buy a jar for $96 and it'll make you smarter and so forth.
Yeah.
And of course, there's a lot of, that doesn't gimmickry and sort of snake oil kind of sales. But the principle of being able to micromanage or rearrange brain function pharmacologically exists. We simply need to do that. There's a lot of talk about the use of medical marijuana, and a lot of controversy about that. And what we really need to do is to look at that drug, cannabis, very carefully and do research and someday have that available through the pharmacy in a pill form to treat pain,
but it's,
for example.
Doctor, it's so fun to smoke it.
yeah, exactly. Well, that's true, and of course that has poses problems as well as possibilities. But
let me ask you about that for a second. As somebody so I take an epilepsy drug today called carbamazepine, and that manages the symptom of severe cramping that I have as a result of this neuromuscular condition. I've read a lot and heard a lot, of course, about how epileptics are taking cannabis. And there are certain situations, I've read stories, I'm sure you know a lot more than I do, about severe epileptic patients who can either dramatically reduce or in some cases even come off epilepsy drugs with cannabis therapy. So what's going on with that?
Well, I think we don't know what's going on with that, but we ought to know. We ought to.
So we don't know what the cannabis is doing in the brain to calm down the epilepsy? No,
we know that we know in some cases it does, that it does work. But in terms of the exact mechanism, pharmacologically or at the synapse level, we don't. But that's what we need to do some legitimate research on. There's no reason, for example, that if we can reduce cannabis down to its, first of all, it's a very complicated drug, 300 and so different elements to it. But if we could isolate some of those and do legitimate kind of FDA research, I think that the day will come. There is an oral form now of cannabis that can be used.
Yeah, it's called chocolates and cookies.
Yeah, that's true.
I live in a part of the world, Doctor. I live in Santa Cruz, California, and very, shall we say, relaxed place on these kinds of topics.
Right.
And so there's a lot of research going on right here in Santa Cruz. I'm just not sure we're capturing any of the data.
I don't think so. And I think what we need to do is capture the data, and so the day will come where you'll be able to go to the pharmacy with an FDA approved form of cannabis dispensed in the usual fashion, and have it work for patients, for example, with certain chronic pain conditions that don't respond to other things.
And it sounds like you feel the same way as it relates to LSD and this microdosing phenomena that we now hear so much about.
We really need to look at that much more carefully than we have, and break it down into its component parts, and what the possibilities are. And I think the possibilities are pharmacologically are really, we know, for example, now we're able to, with cancer patients, breast cancer patients, we're able to do a genetic analysis and find out much more precisely which of the anti-cancer drugs are going to work for that individual. And that's the whole area of medicine is going to become much more in that direction. For example, rather than if I have a patient with depression and there are 20 antidepressants, trying to decide which one is the right one for the patient, yes, we'll be able to do an analysis instead of the trial and error method. We'll be able to simply mate that patient with that particular drug.
And do you envision a day, Dr. Treffert, where, for example, I think about, I've broken a lot of bones in my life doing various things. And I remember breaking my my left arm skiing years ago. And of course they gave me an MRI, and they had given me an X-ray at the ski hill when it first happened. And this was several years ago now, but the thing that really struck me looking at both of them was, just with layman eyes, the difference between a typical X-ray and an MRI was dramatic. And of course, they couldn't tell me much on the X-ray. They could tell me a lot on the MRI, and then the doctors prescribe the appropriate treatment, and away you go, and I heal up, and et cetera. And so I guess my question with that is, are we getting to this place where you envision a similar thing with brain conditions, where there'll be an MRI, if not an MRI specifically, something MRI-like that will pinpoint the area, and therefore you and your colleagues in the medical profession will be able to precisely know and therefore diagnose what is the best treatment for me?
Yes, I do. I think that there are some areas in which we're already making progress in that direction, not so much with the MRI, but with electroencephalography. And being able to look at the brain at work electrically. The problem in the past has been there's so much artifact and so forth in an EEG, but we're able now to rid the film of some of that. And there are places now where one can go with psychiatric disorders and have them do this EEG type work and to make a diagnosis. I don't think we're there yet. I think that but we're getting there, and I think the time will come where we'll be able to make those diagnoses neurologically and psychiatrically, brain disorders, by using these various techniques, and it'll make my job a little easier.
And if we could circle to get to making your job easier, circle back to the 3 R's. So if I remember correctly, it's recruit, rewire, and release. Is that right?
That's correct. Right.
And so in all of these things that you're doing, are you essentially trying to get to those 3: recruit the part of the brain that is not behaving the way we want it to, rewire it appropriately, and then release the capability? Or how should I think about recruit, rewire, and release?
Well, just exactly as you said, we are recruiting non-damaged tissue, rewiring, literally rewiring to that, and then the release of the dormant potential. And it's sort of at that release phenomena that I'm doing most of my inquiry at the present time, because what I noticed in savants is that they know things they never learned, and they know how to calculate, or they know the periodic table, or they know the planets, and they know things they never learned. And that intrigued me as to if that's true. How do they know things they never learned?
Exactly.
Well, I think that I've come to the conclusion that we all know things we never learned. When we start our life, our brain is not a blank disk, and we become what we put on it by education and experience. That's not the fact is the brain comes loaded.
Hold on, doctor. I've heard you talk about this and write about this. I want to make sure I really understand it. For years and years, physicians like yourself, scientists, researchers, believed, did they not, that we were born with a blank hard drive?
Right.
And you do not believe that is the case anymore. You believe we inherit knowledge. Is that correct?
Correct. Right. The tabula rasa sort of theory that we become what we put on our blank disk by education and experience. I think we know instead that the brain comes loaded with all sorts of software, to which we have some access, and others in which we don't have access until something happens. My feeling is, okay, if that's true, how does that get there? And my feeling is that it gets there through what I call a genetic transmission. And that means that our genetics determine not just how tall we are or how much hair we have or the color of our eyes. We also inherit knowledge. And sometimes
exactly the way we inherit eye color, by way of example.
Exactly, right. And there's plenty of room on DNA, for example, you can put the Library of Congress on a speck of DNA, as they're doing at Harvard, for example. So there's plenty of room to inherit.
Our DNA storage space is vast, is what you're telling me.
It is, as you read some of their work, it is simply vast, as to say. And so my feeling is that we inherit knowledge. Of course, this gets sometimes into the nature-nurture argument, and the people who feel that we only become what we are good at through nurturing and practice, they get very irate when I talk about nature. But that's not anything that is really that revolutionary, especially if we go, for example, to the animal kingdom. Butterflies. In the fall of the year, butterflies in Canada decided it would be really nice to winter in Mexico. And so they all go to this little spot in Mexico. I'm sure you've probably seen it. 40 acres where millions of butterflies are there. Well, how do they know how to get from Alberta, Canada to this place in Mexico? And they do it.
It's the tequila, though, isn't it, doctor? Didn't they see the tequila ads on TV?
Yeah, you have to be careful of those ads these days, though. But How do they know the route? How do they have a GPS that takes them there? That's getting there from fall or to the winter spot. The trip back to Canada takes 3 generations.
Wow.
And so the 3rd generation back in Canada has never made that trip to be able to learn it. It is genetically implanted, and they're able then to draw on that. And there are so many other examples in the animal kingdom of complex instincts. And I'm saying we have those also.
And if I could ask you about that, I'm a very enthusiastic, and I say this with air quotes, father to 6 wonderful hens, chickens. And I didn't want these chickens. My wife did. We got them about 5 years ago, and now they're one of the great joys in my life because they're super smart and they're fun and they're funny and they have personalities and so forth. Now, with all these chickens, they're hens, so they're female. And we have gotten most of them at 2 or 3 days of age, doctor. And the thing my wife, Carrie, and I have remarked at, to your point, is how is it possible that a baby chick that's 2 or 3 days old, in the absence of chicken parents, learns to do all of the things that it learns to do? Because nobody teaches it, for example, to dirt bath.
Mm-hmm.
The chick knows that it wants to dirt bath before it's even outside in dirt. It starts doing it in the little fluffs as it's a not even a teenager. And I could give you plenty of other examples. And of course, there's lots in the animal kingdom. But you know, our personal experience, we look at it and go, how is it possible they know how to do all of this stuff that is fundamental to their existence in the absence of being taught that by a parent?
Well, it is instinctual, and they've inherited that. For example, with talking about birds a little bit more, there are certain birds when they do their calls or their songs are very complicated arias, and if you raise one of these birds is either deaf or raise them in an environment where they've never heard the call, they will soon be doing that complicated aria, never having heard it or learned it.
Wow!
So that I think the capacity for that kind of instinctual learning exists, and we're not surprised when we see it in the animal kingdom, but we're surprised when somebody who can barely be verbal is calendar calculating and telling you what day of the year, the week it'll be in 20,215. And so far we've, in the past with savants, have sort of, gee whiz, look at that. Isn't that interesting? And then we go back to our more mundane kind of thinking and leaving them out there sort of like a UFO that some people see them, some people don't. And I'm saying they exist, and we need to understand them, first of all, to help them with their condition, but also to realize what a storage capacity and marvelous instrument that the brain that we have is.
So are you discovering, Dr. Treffert, sort of the essence of what heretofore we've called words like talent or instinct or things along those lines?
Yes, indeed. That talent exists beyond. Interestingly, with savants, when you consider all of the things in the human repertoire, basically savants sort of narrow down to only 4 or 5 or 6 abilities: art, music, calendar calculating, lightning calculating, the ability to do mathematics extraordinarily quickly, and visual, spatial, and mechanical abilities. And through the last 125 years or so of reports of savants, it tends to narrow down to those areas. Now, why Why those particular areas, I'm not sure, but nevertheless, it does narrow down to those areas, and those are end up then being talents, and sometimes at simply a prodigious level that um, Stephen Wiltshire, for example, is in England, and Stephen Wiltshire can take a 45-minute helicopter ride over Rome and view it, and then spend the next 5 days drawing what he saw, window by window and brick by brick. And if you've seen it, if you Google Stephen Wiltshire, you'll see his capacity to do that. Amazing memory. And Stephen tells me that and in the Treffert Center, where we have one of his drawings of Rome, and Stephen tells me that if you want me to do that again, I can do that, because it's up there like a digital image on my
he doesn't have
cell
to
phone.
take another helicopter ride. He's still got the detailed architectural plans in his head.
Right, it's still there. And so the vast, all of the savants have this memory, but it's always attached to some of these skills. And some of the skills have in common pattern recognition, which I think is a basic ability of the brain in certain areas. And it shares that pattern recognition sort of penetrates through all of this. We had talked about, let me just, for a moment.
To interrupt you, Doctor. Is there all of these areas, art, music, calendaring, calculations, etc., is pattern recognition a core element, or is it different into the different areas?
No, it is a core element. Some people say that music is simply mathematical calculating, calculating anyway, in terms of the rhythm and so forth. And so all of these abilities have a pattern recognition that runs through all of them.
So they've literally hacked, if you will, the pattern. And because they've hacked the pattern, when you say to them, what's 432 times 3057, and they spit out the number, it's just not because they actually did the math the way I might try. Well, I can't do math. I'm dyslexic. I'm dyscalculic. But a regular person might try to do that math in their head or write it out. They don't do it that way. There's some hack of the pattern in their head that allows them to come out with the answer. Is that the way to think about it, or how should I think about it?
That's a good term. They've hacked the system, because what happens, one can learn to calendar calculate. I mean, you can look at it. There are formulas, and people can.
You could teach me that theoretically.
Yes, right. And you do it then just like you might do other kinds of mathematical calculations. But with savants, they don't do the calculation. It's there, and it actually appears as an answer visually to them. And if I asked them, well, what is 7,025 by whatever, they will give me that answer immediately, because they see it.
Yes.
It's actually something that they see. And the same is true of the many of the musicians. They don't read music. They simply see music. Derek Amato, who's had the concussion, is not a musician. He just pays attention to the black and white keys that he sees in his head to do the tunes that he does. It is a visual recognition. It's instant, and it's using a much more primitive pathway than you and I use as we might try to calculate the answer.
And so with that, I'm trying to, you see the guitars and stuff hanging behind me. I'm a huge music fan. I think about a lot of the great musicians that I love. One comes to mind. He's the leader of a band called the Foo Fighters, and he was the drummer in Nirvana. His name's Dave Grohl. And he has talked a lot about how he sees and hears music in his head all the time, to the point where it almost haunts him, because there's sort of always new music being created in his head all the time. Is that a savant-like thing, or does he just happen to be super creative, but he's not really a savant? Or sort of how do I know, is Dave Grohl a savant?
Well, I think there are savants, and then there are also geniuses. I think what the difference between a savant and a genius is simply that the savant has an underlying disability, whereas the genius does not. And we sort of lost track of the fact that there is such a thing as genius, because we say, well, Mozart must have been a autistic, a savant, and other people. And I'm saying I wasn't there, so I don't know if they were or not. But there is such a thing as genius, and geniuses may have some rather quirky behavior problems or eccentricities, but those abilities are at the far end of the bell-shaped curve, and that genius exists, and we ought not to lose track of that. But many of the geniuses will have that phenomenon that you just described, that it is music is running all of the time. There's Josh Goldberg is a musical genius. He's not a savant because he's not autistic, but he has that music running in his head, sometimes two tunes at the same time. and I think he wrote 4 or 5 symphonies before he was age 11. But he says that music, and in fact, he says a little bit like some others have said, is that Mozart never really created anything. He simply wrote down what was already in his head. And one certainly sees that with the acquired savant. There often is a trade-off of some ability that gets lost in the transaction. And what always appears is the obsessive compulsive quality. And sometimes it's more of a curse than a gift, because they can't turn it off. There's an orthopedic surgeon in upstate New York who was practicing and had an excellent reputation. He got struck by lightning, and he survived a near-death experience. But before that, he was kind of a rocker, and he liked rock and roll kind of music. But after he got struck by lightning, he began to have this obsession with classical music, particularly one piece that just kept going around and around and around in his head. And so he then learned to play the piano, and he now performs concerts as often as he performs surgery. But
did he play before he was hit by lightning?
No. He learned to play the piano. But the thing that he describes, he said, he would wake up sometimes, and this particular tune was going through his head, and he could see himself in a concert place doing this concert and playing this tune. And finally he decided to, and sometimes when he would play other music, that tune would interfere and want to go back to playing it. And he finally wrote it. It's called the Lightning Sonata, like 26 or 28 pages long. But that phenomena of having something there, which is intrusive and almost obsessive compulsive, is very much a part, and that's certainly true of savants. Who Leslie Lemke, who's a blind pianist savant here in Wisconsin, he has to play the piano, and if he doesn't play the piano, he gets very upset and agitated. Or Alonzo Clemens, the fellow who was on the 60 Minutes program doing the clay, he has to sculpt, and it's as much in that sense of force as it is as a gift.
Yeah, it's also can be a torturer.
Correct.
Yeah. And I want to ask you about this, because as somebody who is dyslexic and ADHD and dyscalculia and something, but partially or some component of bipolar, and you name it, I have come to believe, and I would like you to help me with, am I on the right path or not, that calling these things learning disabilities is really not a positive thing, because while my, if I could call them conditions or differences, come with some very real liabilities, and I could tell you all about them if you wanted, but they would sound very typical to you. They also come with some extraordinary, what I would consider, gifts. And the education system is such that kids, at least in California, who are dyslexic or have any of these other sort of related things, can't get help they need dealing with the liabilities unless they're diagnosed as having a disorder or disability. And then the way the school system deals with it is to try to mitigate their disorder. And I'm very upset about this. I think it's bullshit. And the reason I think it's bullshit is, well, yes, all of those things come with significant liabilities, which I experience on a, in some cases, moment-to-moment basis. However, I think that many of us who have these kinds of things have extraordinary gifts. And the confusion that I have is, why don't we spend, I'll just start here and you tell me, 50% of our time helping folks deal with whatever the liabilities are so they can live a positive life. But 50% of the time working on the gifts, these patterns that they see, whatever their creativity is, whatever innovative, whatever it is. And so am I on the right path here, or am I thinking about this the wrong way? Or how should I think about people with these conditions, but that also have these capabilities?
Right. Well, you are on the right path. And I think instead of calling it a learning disability, what we ought to call it is a learning pattern. Some people have a different pattern of learning than most of us do. And to try to fit everybody into the more traditional kind of learning patterns that the school uses does a disservice to those who have a different learning pattern. And with that learning pattern come other strengths. We have at the Treffert Center, we have our own school, and it's a strength-based curriculum. We're looking at the strengths of the child rather than the liabilities of the child, and building on those strengths, whatever they happen to be. And those children who have certain learning patterns, we have to adapt to those. For example, children who are hyperlexic have many times difficulty understanding conversation or oral conversation. And so what we find is if we write it out, they can understand exactly what we're saying. When in doubt, write it out.
For example, I hate to interrupt you, but for those kinds of folks, they might not want to consume a podcast, but they might love to consume the transcript of a podcast.
Sure, exactly. And so what the school needs to do then is to adapt to these learning patterns rather than calling them disabilities. And in that learning, with those learning patterns, as you say, there are many gifts that often are associated. Those tend to be trivialized or not paid attention to in many school systems. But the hyperlexia, the ability to read early, is an entry into education for these way of learning, teaching these kids using that hyperlexia and minimizing some of the problems that go with it. So you're right that I think there is in the school system, there's a sort of a one-size-fits-all approach. Often a left brain approach, by the way, rather than a right brain approach to education.
Right, those damn right brainers.
Yeah. And so but being able to adapt to that, first of all, to recognize. And I'm a physician, and my most important rule of thumb is that the first step in treatment is to make the right diagnosis. It's the difference if the patient. It's different whether the patient has a sinus infection or walking pneumonia, but I should be able to make the diagnosis up front. And that's what we need to do a better job of now, early on, and earlier. In our kids in our school presently are 18 months to 3 or 4 years, and we're in interventions with those are showing really tremendous results instead of waiting till the child is 7, 8, 9, or 10. But you're right.
It blows me away on this. I have a nephew who at one point we thought might be dyslexic. It turns out he's not. But when his mom, my sister-in-law, went to his teachers and said, hey, can we have him tested? Can we look at this? What they responded to, and this was 2 years ago, 3 years ago, was, well, he's doing okay and he's doing well enough now. Why don't we just let him keep going and kind of see how it plays out? And I thought to myself, what do I know? I got thrown out of high school. But I looked at that and thought, that's one of the most moronic things I've ever heard a professional say. If this parent has a legitimate concern, and why not get on it right now? Both to deal with the liabilities and to deal with the natural assets that come with whatever might be his difference. In his case, it wasn't so, but it seemed crazy to me that in the modern era that professionals in our education system might even consider waiting to deal with stuff like this.
Right. Used to be that kids coming into the system with autism, for example, would be 5, 6, or 7 years old. Now we have the birth to 3 programs in many areas of the country that encourage parents to bring to their attention if there are some concerns about developmental delays or other kinds of issues to have an evaluation done. Many times these are situations that are not necessarily needing remediation, but other times they are. But of course, we just on Monday of this week we had a conference here in Fond du Lac on hyperlexia and Einstein syndrome, and many parents were there telling their stories and looking for advice. And a common complaint by many of the parents was that, we wanted to have an evaluation, but we went to the hospital or the clinic and they said, we've got a waiting list of a year. And so in a year we'll be able to, and I spoke to a mother the other night and she was just in tears because she said, I've done all the right things. I want the evaluation. And they said, well, we'll put them on the list and we'll see them in a year. And that is just, you don't do that with cancer, or you don't do that with a lung x-ray that shows a lesion and say,
right.
Well, yeah.
And then the other part of it, I think of is, so that's the mitigate the negative part. But on the positive side, if this is a child who's maybe super creative or incredible at math or has any of these assets that come with some of these liabilities, on the same token, Dr. Treffert, don't we also want to start tilting that child's education to their learning patterns so that they can excel in the areas that they are naturally excelling in?
Yes, and that's what we call strength-based curriculum, where whatever the strength is, you're building on that instead of the deficits or the areas in which they might be behind. And I think we're making some progress in moving in the direction of strength-based curriculum rather than one size fits all, but we certainly have a long ways to go.
Do you see a day where most schools have this strength-based approach?
Yes, I do. I think that it's convincing, and if we can, in our school, we have a limit to how many students we can accommodate, but we can train the teachers. We can train the teachers to do what we're doing and sort of metastasize ourselves in that way. In
a good way, metastasize.
Correct, right. So I think that and I've seen, I think, movement in general education in that direction.
So, doctor, as both a practicing physician, as somebody who's run a mental health facility, which I really want to talk to you about as well, if you have some more time, and a huge educator. I mean, your commitment to education, your books, your writing, your talks. I mean, it's extraordinary. And so, given all of your experience as both a doc and a teacher, what's the big advice you have if I'm a parent or an adult with a child in my life that's got some kind of a learning difference, some kind of a neurological difference along the lines that we've been talking about? What would you suggest I do?
I think you need to have an assessment by a competent and person, a professional who is really avant-garde about where we are in our thinking about all of these areas. Takes me back to my first step in treatment is to make a diagnosis, and then to so if that assessment or that advice doesn't seem to make sense to the parent, to get a second opinion. In other words, follow their intuition. Mothers and fathers know their kids best. They're the real experts when it comes to their child. And if it doesn't feel right, and we see that with hyperlexic children who are given sometimes automatically a diagnosis of autism, and they are not autistic. What happens with hyperlexic children is that they read early, they have some autistic traits for a period of time. There may be some echolalia, there may be some stimulation, stimming, but they seek and love affection. They're not in a world of their own. They're not withdrawn. And mothers will come back with a diagnosis and say, look, I looked up autism on the internet and this doesn't sound like my child. And that's when they write to me and they say,
Google told me this is wrong and I need to talk to you, doctor.
Yeah. So they'll send me an email. I get several every day. I've got a son or daughter who, and they'll describe what's going on and what advice might I have. And typically it is to get to some knowledgeable and competent professional, and then to make educational decisions that are the correct ones. Should this child be in special ed? Should they be in Montessori? Should they be in the regular school system? Many of these kids who are hyperlexic are misplaced into special education classes because the suspicion is that they're autistic. So my advice, I guess, is to get a competent opinion by a knowledgeable professional and then follow up. And if it doesn't feel right, to get a second opinion.
Keep going, yeah.
Yeah. Mm-hmm.
Let me just tell you the story, and then I have a question about adults in this situation. So I have a dear friend, a guy I consider an adopted brother, and he's around my age. I'm turning 50 this year, doctor. And his father, who's in his 70s, at least to us, seems very clearly dyslexic. And he, like a lot of us kind of folks, he has some significant liabilities, and yet he has that, did you call them mechanical abilities? Was that the term you used earlier?
Correct.
So he has extraordinary mechanical abilities. He can put together a vintage, Cadillac, and that's one of his big things is that kind of stuff. And he, like a lot of us folks who have these various things, grew up feeling like he was stupid, being told he was, as I was, not by my parents, but by educators. And he is, in his mid 70s or so. And I could just tell by the first conversation I had with him how much pain and sorrow there was. And that in spite of my best efforts to educate him that he was actually kind of a genius and that he has these extraordinary gifts that are very evident, and he shouldn't worry about this other stuff that, he can't do. That pain and suffering from his childhood is still very much there. And it's just, you scratch it a little bit and bang, there it is. And so that leads me to a question, which is, if I'm an adult, wherever I am in my life, and for whatever reason, I grew up not understanding this stuff, and now I'm beginning to understand it, what would you say to me about how I should think about this and really live my life going forward?
Well, I think, as you already have said, that to reassure the person about the strengths that they have, without emphasizing whatever trade-offs there might be, and that the islands of brilliance are valuable in and of themselves and are not that common. I mean, they have something special. They do have a special ability. Sometimes being able to make friends with somebody who has that same issue, or even a Facebook group of people who have that same,
Yes.
will compare. The thing is, for example, with acquired savants, what happens with most of them is that when they awake, they have these images, a sea of images of all sorts that kind of change the way they see most everything, and they think they're losing their mind. They think they're going crazy, and sometimes won't even share their special gift with other people for fear they will say you're crazy or you're like Rain Man or whatever. And so they don't actually share their giftedness because it's going to be, it may label them as somehow different or losing their mind. So I think that kind of reassurance and that kind of friendship is invaluable as they begin to see what the flip side of their disability is, this incredible ability.
And one of the things I've of course had to deal with in my life is this, and I've gotten to a place where I say, who gives a shit if I can't do math?
Yes, right.
Like really, there's some base level of math you need to get by. Mine's a very remedial one. But then to your point with the new technology and the kind of world we live in today, I just am upfront about it. So if you and I go to dinner and let's say I'm taking you to dinner, which I would love to do, and the bill comes and I give my credit card and it comes back and I now have to calculate the tip, I'm going to ask somebody for help.
Correct. Mm-hmm.
Because even though I can try to, there's tips and tricks I've learned along the way. If I have to do it on my own, I will. But I know there's a high degree of likelihood I'll still get it wrong, even if I try to simplify it as much as I can for myself. And so it's just a lot more efficient to say, hey, I'm sorry, could you give me a hand? I'm dyslexic. I can't do this math. I'd like to give this waitress or waiter a wonderful tip. What would that be here?
Mm-hmm. Sure.
And so like, who cares that we can't do that? There's lots of people who are great at math, right?
Yes, right. And there are a lot of who are, including myself, who are not. Math has never been if I had a head injury and became a savant, it would not be math. And likely would be mechanical skills, because I do have some ability to problem shoot and to understand mechanical things. I think all of us, the other message, I guess, is all of us have some areas in which we're not very proficient. For example, I cannot remember names. I can remember faces, but I will meet somebody and I know that individual. And sometimes I have to apologize for the fact that I'm sorry. I'm not very good at names. I know we met before, without trying to fudge it or hedge it.
I think we should all just wear name tags at all times to make it really super great for everybody. Nobody has to feel bad about that one anymore.
Yeah, exactly.
Now, Doctor, if I could have you for a little bit longer, I have a couple of other.
It's fine with me.
Awesome. A conversation with you is not something that comes along very often in my life.
Yeah.
I'm curious. I've been doing a lot of reading, and obviously I've consumed a lot of your work. I'm curious to delve into your thinking around the mind and the body. Obviously, the brain talks to the body through the neurology, and even this sort of emerging set of thinking that the paradigm that we have developed over time, which is like that our brain is one thing and our body's this other thing, and the brain's the computer and the body's the machine, and these sort of analogies we've heard over time. Some of the things I've been hearing and reading are that those analogies, those metaphors, those paradigms are actually not helpful, that our brain and our body should not be thought of as one. And so I'm just curious how you think about all of the 50 years of work you've done on the brain, and then the physical component, brain and body.
Oh, there's such an intertwining of the brain and the body that it's one ought not to even think of them as separate.
Is it silly that we ever disconnected them in the first place?
Well, I think it is, but I think that era has is diminishing or vanishing, but the ability of the brain and the body. For example, the serotonin, which is a metabolite in the brain, a neurotransmitter. The largest producer of serotonin is in the gut, and the relationship between the gut and the brain is an extraordinarily close one. And as we try to understand the disorders that affect both those organs, we have to look at them together. The area of integrative medicine, where we don't separate ourselves into all these little portions and spots, is I think upon us. And I think what's emerging from some of the brain studies, especially with our more sophisticated techniques now, make it impossible to think in terms of separating the mind and the body, I guess. So in my world, the ability of the body to reach a homeostasis, there's a continual thrust in our body toward homeostasis, which means a balance and a normality. I can, for example, take a blood sample from you today and run 129 different electrolytes or lipids, and they will be within a very narrow range. I mean, no matter what you ate yesterday, your sodium level will be within this very narrow range. So the ability of the body to achieve this homeostasis and to kind of heal itself and to have an urge toward healing is simply powerful. And the more I've worked in this area, the more evident that is to me. I guess a more difficult question is there a difference between the mind and the brain? Is there a difference between the mind and the brain? The brain being the physical organ that we know as it, but then we talk about in my mind. And Dr. Luria, who I mentioned earlier, spent his whole life dissecting the neurology of epilepsy and probing these people, as I mentioned, where these memories would come forward. At the end of his life, he came to the conclusion that he thought the mind was bigger than the brain, and that gets us into another whole area of inquiry.
Well, and I'd love to go there if you have time. So I'm somebody who is always, or not always, but often trying to do new physical things. And ever since I got diagnosed with my condition, I've been working on physical things that are challenging for me. So for example, the left side of my body is meaningfully weaker than my right side, which I guess is normal, but it's very exaggerated for me, that imbalance. I have often wondered if that has anything to do with my dyslexia and so forth.
Yes, it does.
It does.
Yes. Yeah. I think that reflection of left-sidedness or dominance has a role certainly in a number of neurological and language disorders. For example, children with Einstein syndrome, the center of their language ability tends to be right brain instead of left brain compared to hyperlexic children.
Oh, interesting.
But that does get reflected in our lateralization overall.
And so it could be that because I am more, you tell me, I mean, what do I know? I'm talking to a genius about this and I got thrown out of high school, but that the fact that I'm creative and have those sort of traditional skills, if you will, that a lot of dyslexics tend towards, and the fact that my right side of my body is so much stronger than my left side of my body, those things are likely not coincidences.
Are not what?
Coincidences.
No, indeed, there is the lateralization is an important part of ourselves, and one of the we were talking earlier about ways to tap into those buried potentials. I mentioned electronically and pharmacologically, but also sometimes we can do that directly, just cognitively by working at it. There's a book called New Drawing on the Right Side of the Brain.
It's called what, doctor? I'm sorry?
New Drawing on the Right Side of the Brain.
New Drawing on the Right Side of the Brain.
Right. And what this woman who is an artist does is she takes executives or persons like yourself or whomever and she teaches them how to draw, not because she wants them to become artists, but because she wants them to spend more time in the right hemisphere rather than the left hemisphere. So she'll take executives from various firms who are really good at logical sequential thinking and counting the digits and the widgets and balancing the books, but they're not really good in vision, in seeing the big picture and seeing just that, seeing the big picture instead of the minutia of the business. And it turns out that that by this deliberate process, they can spend more time in the right hemisphere, touching their creativity and touching their skills that otherwise sometimes are seen as sort of frivolous or, I'll do that when I retire. When I retire, then I'll be able to do the art or the music or the archaeology that I always wanted to do, but I can't do it now. And so there is a direct cognitive approach that can have us touch our spending more time. I call it rummaging in the right hemisphere.
It's so funny you say that because I have it in my notes and I wanted to ask you, but that's such a great expression. So unpack that a little bit more.
Okay. We're a left brain society. Logical, sequential thinking and language have served us very well, but those are left hemisphere skills, and we don't spend as much time as we should in some of the right brain activities, or at least we tend to trivialize or to minimize those. And I use the example, for example, if I'm traveling from here to Chicago, I'll take the freeway. I know all the exits and entrances, and I'll sort of do it unconsciously. And when I can't remember whether I went through Racine or not when I get to Chicago, but it's a very express trip, quick trip, gets me there as efficiently as possible. Well, some other times I'll say, I've got a little more time today. I'm going to take Highway 41 along Lake Michigan. It runs along Lake Michigan through these beautiful little towns along the way, and it's going to be a heck of a lot more relaxing and more illustrative trip. And that's what I call rummaging in the right hemisphere with a lot of things that we do. I happen to cut my own grass, and we've got a lot of grass on our land, but I do it not to save money, but I love driving my little tractor. First of all, I can't hear my cell phone on my tractor because it's making more noise.
And no matter what age we are, Doctor, we're always little boys who like to play with tractors, aren't we?
Absolutely, right. And why not? I love it. And so that's part of my mechanical leaning. But so I'll do that. It makes sense to hire somebody and save some and use my time for other things, but I happen to like that. Or we've got a waterfall on our property, which is really a beautiful bit of nature. And I'll sit down there sometimes and just listen and watch and smell the waterfall. And to compete with all the other stuff that I'm doing, I'm trying to. I have an orchard, and I'm trying to learn all about an orchard. Some of the patients that I treated in the past who were farmers, they know all about orchards. They know all about nature. They know the signs and of the seasons and so forth. And that's a whole other bit of knowledge that most of us don't have. And so I'm trying to learn. So anyway,
that's
right.
Just as a side note,
yeah.
My father-in-law runs what we believe is the last commercial orchard in San Jose. He's got about 2.5 acres with 600 or so fruit trees. Lives on the property and works about 6 hours a day most days, and picks stuff and puts it out on a fruit stand on the side of the house and sells that stuff on the honor system. And the whole family surrounds him, and when he needs help, we're all there. Sometimes he hires some help, but when he has to do big pickings or there's big stuff going on, the whole family chips in and so forth. And so I appreciate very much what you're saying. In the last few years, I've learned when and how to pick a peach, and all of those kinds of things that you yourself are probably delving into now. And it really, look, I have no desire to be a farmer whatsoever.
Yeah.
It's not my natural thing, but there's a joy to learning that stuff, isn't there?
Yes, there is. There is a joy, and it taps, I think, other parts of us in terms of the creative parts of ourselves, or the musical or artistic, and it just makes us a more rounded individual. And I'm not doing it to become more rounded. I'm doing it because it gives me a certain satisfaction and joy.
Yeah. And is this where you start to delve into the distinction between the brain and the mind? Is this a mind happiness thing or that you're doing, or how do you think about that distinction as it relates to something like this?
Yeah, well, I think that some of the distinction between the mind and the brain does have to do with satisfaction and a sense of fulfillment. But then I'm getting into another whole area now with a couple of individuals with the whole idea of ESP and thought transmission. Is that real or not real? And that gets us into the larger issue of the mind and how it is there a collective. When I was in training and read Carl Jung's stuff about collective unconscious, I thought, oh, that's a bunch of junk. I mean, that's awfully soft stuff, and I'm not sure that even exists. I'm beginning to wonder now about that, because some of the autistic youngsters that I deal with are able to, about 1% of the parents of autistic kids report some kind of paranormal ability in those youngsters, and I'm beginning to explore that and working with one individual particular where I'm convinced that's so, and that takes us outside of the brain into the mind.
Well, and to that end, if I could connect that maybe back to the body, you tell me if this is how you'd like me to think about it. So one of the new things I'm doing is Pilates. And the amazing thing to me about Pilates is it's very isolating of a specific part of the body. And the Pilates instructor will put your chest in exactly a certain spot and your foot in exactly a certain spot. And in my case, she'll say, okay, so isolate this. And she'll say it to me, and I won't know how to do that. And then she touches me. She'll poke me in a very specific spot in my lower back, by way of example. And I am able to hold one part of my body in a relaxed way, another part of my body in a very rigid way, and et cetera, to get into the exact position she wants me to. And once she describes it verbally and then touches me, my awareness moves. And I get out of Pilates, doctor, and I'm exhausted, but I'm not exhausted physically. I don't find it physically challenging in the way that I would a long run or a long surf session or a martial arts training session where I'm exhausted. When I'm done Pilates, I'm much more mentally tired because you tell me whether it's my brain or my mind, has been orchestrating all of these maneuvers, and what she's really doing is moving. The experience I have is my awareness moving around my body in ways in which it never was before.
Correct.
And so what is that? What's happening in Pilates, and why am I exhausted afterwards, even though it might have been physically hard, but mentally I'm like, wow.
Well, you're getting into a different level or area of consciousness. We think of consciousness pretty much as you and I are conscious and we're talking with each other. But when I talk about ways of connecting ourselves with our buried potential, another way is with meditation. That takes us into a different level of consciousness. And meditators will have the same kind of experience at the end of it that you do, that they're exhausted, but exhausted in a very a pleasant kind of way.
Yeah, very fulfilling way.
Right, because they've entered a different level of consciousness than that in which we operate most of the time. And that's just further exploration of the complexity of ourselves and of our brain. And so if we take ourselves out of the usual routes, the way we've been talking, whether it's electronic pharmacologically or deliberately, and now with meditation, we're able to get in touch with different parts of ourselves that we are ordinarily simply would go along and never having experienced or acknowledged. And that's getting in touch with those areas, are really getting in touch with our potential, and especially our creativity, that is exhausting at times, but it's also fulfilling, and it sort of can be exhilarating at a different level.
Yeah, it's fascinating. And so you really believe that it's powerful to distinguish the brain as an organ and the mind as what would you call the mind?
Well, that's a good question, and I'm working on it.
Is there a new word, Dr. Treffert?
I think I'm going to have to invent one. But
if anybody could or should, it would be you. I would imagine.
But yeah, I do. It's sort of a transcendental kind of view of the brain, and I don't mean that in a really esoteric kind of way, but it really is looking at the magnificence of the brain at different levels rather than the ways we typically experience them, and that having done that, or people doing that, will discover some part of themselves or some capacity or some interest which simply wasn't there before, and it simply transcends the synapse and the neuron into some other kind of integrative state, maybe a different level of consciousness, but it is a fulfilling and creative use of our ability in the brain.
And the last couple paragraphs out of your mouth, those are the kinds of things I might expect to hear from a teacher at the Esalen Institute, or something along those lines. Not a learned physician, researcher, teacher, healthcare professional, director of a hospital. What you just said sounded very, frankly, Santa Cruzian, left coasty, airy-fairy. I smoke a bunch of pot and talk about all this stuff, right? And yet you are quite the opposite of that, as far as I could tell.
Exactly. The areas in which I ventured into with the savant are not areas I would have ventured into ordinarily. I've sort of been led into them by meeting with these people with such unusual abilities, and especially superimposed on their disabilities. But I'm the last or the least likely person to ever even be exploring ESP, for example.
Yes.
Was very skeptical and critical, and yet I have to comment on what I am observing, and that's really what my whole career is. I have a sort of an insatiable curiosity about things. Unfortunately, I'm sort of like a butterfly. Instead of landing one place and really going farther and farther into this very, very narrow, I tend to see another flower over there, and that looks interesting. And so
are you chasing pretty colors? Are you like me, where if a zebra or a pretty lady goes by, all of a sudden?
Yes. So it's led me into these areas, but it's simply a larger self. There's a neuroscientist who had a stroke and recovered from the stroke after a long period of recovery, and she describes now her island of genius, or whatever, is a place that's more peaceful, that's more sort of larger than herself, and she can visit that place or unvisit it at her leisure. And I don't know what to name that, but in terms of what we're talking about as being Esalen, like I guess my summary of this is in a different book entirely. It's called Mellowing. In the book, my definition of mental health is being relaxed, at ease, and pleasantly convivial. And
pleasantly what?
Convivial.
Convivial. What does convivial mean?
Being interactive with each other in community kind of way. Relaxed, at ease, and pleasantly convivial. And I have listened to patients for 50 some years, and I put together this book called Mellowing, based on a little bit on the song "Have You Never Been Mellow?" Trying to find a comfort from inside you.
Yes.
So instead of this more esoteric kind of mind talk, in the Mellowing book, I talk about priorities and finding that comfort with inside yourself. And so that's more traditional, probably. But I find myself, the more I deal with savants, drifting in this other direction. But it's the same direction. It's the same search. It's just in different words.
Fascinating. I also have to ask you, Dr. Treffert, what was it like to work on Rain Man?
Oh, it was great. I was totally surprised when I got a call from the executive producer in Hollywood, calling me in Fond du Lac, Wisconsin, for heaven's sake. Most people don't even know where it is. And I said, "What?" She said, "Would you be willing to look at the script for Rain Man? We have the script, and would you be looking to look at it?" And I said, "Yeah, but what looking for what?" She said, "We want the movie to be accurate, and we want it to be sensitive." Now, that's not something that Hollywood is ordinarily known for. But I said, with those two things, looking for those two things, indeed I will. And in that original script, there were some scenes that were preposterous. After the Las Vegas event, Raymond and his brother are being followed by some crooks who want to take the money that they earned, and they end up in a barn. And Raymond runs around, he picks up some scattered parts from the from the barn. He makes a motorcycle a sidecar, and they run out of this burning building in the motorcycle in the sidecar. And I said, you don't need to embellish savant syndrome. It doesn't need to be Hollywoodized.
It's already wild and different and fascinating enough, right?
Right. And so I said, let's stay with those savants we already know. So the toothpick scene and the memorizing the phone book, knowing how to compute square roots, but not knowing the difference between a candy bar and a sports car. Those are all based on real life savants. It's a composite savant. It's not the story of Kim Peek, who was the inspiration. It is a composite savant. So I think contributed at least to the accuracy. And then I think to the sensitivity also. And they did not want to offend the parents of kids who are autistic. And I think, as far as I'm concerned, the film met both those criteria of being accurate and being sensitive. And I think it's the best thing that's ever happened to autism.
Really? Why would you say that, doctor?
Because it put autism on the international radar screen. The word autistic savant became a household term, whereas before that, nobody knew much about autism or savants. And it was a tremendous awareness piece. And so I was glad to be a part of it. Actually, I did not end up on any of the settings where they were filming it because our schedules just didn't jive. They kept changing their schedule and I couldn't change mine. But so when they put the piece together, finally I got a call on a Friday night and they said, do you want your name on the credits or not? And I said, well, I think I'd like to see the piece before I know whether I want to put my name on it. Because,
good answer, doctor.
Yeah, because I said, I don't know, my reputation means a lot to me. It means nothing to you, but I don't know. I don't know what the final product will be. And I said, why don't I come out there this weekend and look at it? And she said, look, that film is still on the cutting room floor in pieces and bits and pieces, and we'll have it together on Monday. But so I didn't see it until, anyway, she said, do you want your name on the credits or not? And I said, yeah. And so I'm glad that I did, because I think it was a marvelous piece of work, opening up that whole area to so many people.
Well, and this may sound funny for me to say this, but thank you for doing that. I love that you care about the way autistic people are viewed in the world, and the care that you took to try to help Hollywood get it right. That's wonderful.
Yeah. Well, it as I said, it turned out to be Barry Morrow, who wrote the piece, and I have become very good friends, and he's had a couple of other films even before that where this in my dealing with the savants, it's been I've been intrigued, obviously, with the science and with the brain circuitry and that, but I really have been most blessed to be able to meet the savant and their families. And such a big picture, or big part of the savant, is the person behind the savant, the mom and dad who know about the handicaps, which we may not even see, and yet have devoted their life to them and their love. And when these parents write to me about their children, whether they are savants or not, and what to do, what kinds of interventions help, I always point out that because through these messages comes their love and their pride in their child. And I say love is a good therapist too. We've got all these techniques that we use, but I once had a little boy at Winnebago in my children's unit who was by the name of Jimmy. And one day I said to Jimmy, how come you had to come here? And he said, because I had a nervous breakdown. I said, Jimmy, what's a nervous breakdown? Well, he said, a nervous breakdown is when nobody loves you. And so in our treatment programs, with whatever science we're using, love is such an important part of that. transaction that maybe is more mind than brain. I don't know, but I don't care where it is. It's a powerful force, and that has really been what keeps me going. At this point, I should really be retired, and I should be out in my orchard more than I am, perhaps. But it is that the interaction with these. We had an open house Monday night after our conference, and displaying the art of some of the kids that we're treating in the center, and it was just a magnificent. Met some really magnificent people, the parents of these youngsters, and the pride that they have, the concern, the fear that they have, and I'm trying to allay some of that fearfulness in them about outcome and remain optimistic, because the longer I work in this field, the more optimistic I am about all of us, individually and collectively.
Wow. Well, Dr. Treffert, I must express to you, of course, you and I just met, your love of people and the people who you serve, and your area of research, and it comes across. It came across when Carrie and I saw you on CBS Sunday morning, that you were a very special person. And there's this expression, I wish I could remember now who said it, but the expression is, who you are speaks so loudly, I can barely hear what you say. And as I have been trying to be diligent during our conversation to make notes and make sure I capture some of the amazing learnings that you're sharing with me, that is the big thing that I'm present to, is just your love of this work, and your love of this work because of these people. And so thank you for that.
Well, you're very welcome. And that's what keeps me going to work every day. I had a birthday recently, and so the kids at the school threw this birthday party for me, and they had the very variety of banners, and one of the banners said, "Thank you for finding our island of genius." And to me, that just makes it all worth it.
It's such a wonderful phrase that you created too, island of genius.
Mm-hmm. And it is, and that is what it is. And some people, the island is surrounded by treacherous waters, and others it's not as treacherous, but that island of intactness, and or island of ability and genius, that search is where I started. I started my career surrounded by little kids at the Winnebago. Then I did a lot of other things, and now I'm surrounded by kids again, and it's just it just seems like a new beginning.
How exciting!
Yeah.
Dr. Treffert, is there anything else before we wrap up today?
We've covered an awful lot of ground, and I hope that it makes sense and people can extract from it their own meaning. I hope that all of us can remain relaxed, pleasantly convivial, and at ease, and meanwhile engage in this more scientific and precise research, and have a merging, because the study of savant brain, I've learned as much about human potential as I have about the brain itself, and we need to study those collectively and together rather than separately, and I think that's happening.
Well, Doctor, I can't thank you enough for your incredible work. I love your orchard, but I hope you never retire, at least retire completely. When we had Bill Walton on the show, who I mentioned to you earlier, he gave me shit for saying that I retired after my book came out. And he actually got me to see what was actually the truth, which is I no longer did one thing, but I am now doing a bunch of other things. And the truth is, what I was doing before and what I'm doing now from a, if you will, mission point of view is the same. It's just doing it in a very different way. So anyway, all I'm trying to tell you is what he told me, which is don't retire. and look, we need you. The world needs you. Right. You are a gift. You are incredibly generous. And I can't thank you for an extraordinary amount of work and an extraordinary conversation today.
Well, I appreciate your interest in what I'm doing, and let's stay in touch.
We will, Doctor. Bless you.
Okay, thanks.
Bye-bye.
Bye.
It's hard to have much else to say after a conversation like that other than thank you, and I'm grateful to be able to share it with you. And if you know somebody who would love this conversation with Dr. Treffert as much as I hope you did, please share it with them, and we would love you if you shared this episode on social media. You know, the fascinating thing is I discovered him by watching him on TV. I saw him on CBS Sunday Morning and reached out to him directly, and obviously he responded positively. The interesting thing is, if you see Dr. Treffert interviewed on television, you know, if you're lucky, you get 6 to 8 minutes with him. 15 minutes of him would almost be unheard of. And so the fact that via this incredible medium of podcasting, we get to have a free range, authentic conversation and really delve into this extraordinary man's extraordinary life work with these amazing people and share it with you in an unedited, open dialogue way. Well, I don't know. It makes me happy. Seems like too weak of a word, but and grateful seems too much of a cliche. So I don't know what word to use, but you could never do this on radio. You could never do it on TV. Podcasting is the only medium where an extraordinary man like this can share a conversation at this level. All right. Legends and Losers is sponsored by our dear friends at Oracle NetSuite. I'd encourage you to check out netsuite.com/legends. And when you go there, you can download your free guide to this incredible booklet called Crushing the 5 Barriers to Growth. And while you're there, you can schedule a free business review to set up a time with a NetSuite expert in your industry to talk about what the opportunities for growth might be for you and your company. And so NetSuite is offering Legends and Losers listeners a free hour-long discussion with a growth expert in your industry. Now, Investopedia says that money management and fatigue are 2 of the biggest challenges facing growing businesses. And if you think about that, you think, well, how can we use technology to deal with money management and to deal with fatigue? As a growing business owner or leader, it's easy to feel like you're under the bus. NetSuite is purpose-built to get you driving the bus, if you will, and try to deal with money management and fatigue for business leaders and owners. On NetSuite, you can run every aspect of your business, from orders, cash management, inventory, finance, HR, and more. You can stay up to date with tax laws. Now, I know you love tax laws. If you're on the finance side, you need to make sure your capabilities are, if you will, tickety-boo, that you're up to speed with the new audit requirements, financial reporting, consolidation, and new accounting standards like one I've been reading, ASC 606. Not been reading that. But if you're an accountant, you're a CFO, you need to be on top of it. NetSuite is a complete business management system in the cloud. It gives you the power to drive the bus. It gives you the power to run your business from your browser or your smartphone. Over 40,000 remarkable growing businesses have built their growth on top of NetSuite. It's grow time for you, so go to netsuite.com/legends. Well, thanks again. I'm still floating after our conversation with the good doctor. We would love it if you went to legendsandlosers.com and subscribed. And Heather Clancy and I have a new book coming out called Niche Down. We would love, if you want to be part of our street team, that is to say, the team of folks that are going to help us give feedback on the book and also help us promote the book when it comes out in the summer of 2018. Send email to blackhole@legendsandlosers.com with the subject Niche Down, and we will send you a copy for free of the first chapter of Niche Down. And we'll just ask you to give us some feedback if you like. And when the book comes out, help us promote Niche Down on social media. All right. We would like to thank Dr. Darold Treffert. What an extraordinary episode. Thank you so much, Doctor. HarperCollins instant classic, Play Bigger, How Pirates, Dreamers, and Innovators Create and Dominate Markets. The good people at Equity Directory connecting startups to the talent and resources they need to build a legendary business. OneLifeFullyLive.org. Dream, plan, and live your best life. Check it out today, OneLifeFullyLive.org. My good friends at Spiro, the sales app for salespeople and sales managers who like to make money. Run your entire sales operation from your smartphone at spiro.ai. Outposition.com, legendary marketing and category design in Singapore. Check out out-position.com. PursuingResults.com. They produce legendary podcasts, and every once in a while, they produce this one too. If you want to start your own podcast, check out PursuingResults.com. And speaking of podcasts, if you're a thought leader and you want to get your leading thoughts on podcasts, check out InterviewValet.com. They specialize in podcast interview marketing. They have represented me to get me on podcasts for over a year now. They're an amazing group of folks run by our good friend Tom Schwab and Dan Moyle. Check out InterviewValet.com and get your leading thoughts on some podcasts. The legendary business book, Scale, by the incredible entrepreneur, CEO and leader Jeff Hoffman. It's an amazing read. It's an important read. And if you want, check out Jeff Hoffman on episode 88 of Legends and Losers. A podcast we love, Stop Riding the Pine with Jamie J. Subscribe today wherever you subscribe to legendary podcasts. Stop Riding the Pine. And Doctors Without Borders. Check them out at doctorswithoutborders.org. They make a difference in some of the most challenging places on planet Earth. doctorswithoutborders.org. All right, we must remind you that this oddcast is a sole property of the Legends and Losers Oddcast Network, and we would love it if you shared the shit out of it. All rights do remain disturbed. In the event of business bullshit, please take 2 Legends and Losers and tweet us in the morning. We must remind you that this oddcast is clearly produced in a studio that does contain nuts. Legends and Losers is never tested on GMOs, but may contain forward-looking statements, backward-looking statements, and completely preposterous statements. Listen to Linkin Park. Support your local genius. Don't be lame. Get out of the passing lane. Hey, man, that suit is you. Thank you so much, Candy Dandy. Love you, Mom and Dad. And hey, Colin, this oddcast really ties the room together, doesn't it? Today, our deepest apologies go out to Nick Hallstad, CEO of InfoSum. Sorry, Nick, we just ran out of time for you. That's it. Thank you so much for investing your life with us, and we'll see you again soon on Legends and Losers.